High blood pressure, hypertension. Everything you need to know about high blood pressure. Your blood pressure measurement takes into account how much blood is passing through your blood vessels and the amount of resistance the blood meets while the heart is pumping. High blood pressure, or hypertension, occurs when the force of blood pushing through your vessels is consistently too high. In this video, we'll cover the basics of hypertension, including its symptoms, causes, how it's treated, and more. What is high blood pressure? Narrow blood vessels, also known as arteries, create more resistance for blood flow. The narrower your arteries are, the more resistance there is, and the higher your blood pressure will be. Over the long term, the increased pressure can cause health issues, including heart disease. Early detection is important. Regular blood pressure readings can help you and your doctor notice any changes. If your blood pressure is elevated, your doctor may have you check your blood pressure over a few weeks to see if the number stays elevated or falls back to normal levels. How to understand high blood pressure readings. Two numbers create a blood pressure reading. Systolic pressure, top number, indicates the pressure in your arteries when your heart beats and pumps out blood. Diastolic pressure, bottom number, is the reading of the pressure in your arteries between beats of your heart. What are the symptoms of hypertension? Flushing. Blood spots in the eyes. Subconjunctival hemorrhage. Dizziness. What causes high blood pressure? Genes. Some people are genetically predisposed to hypertension. This may be from gene mutations or genetic abnormalities inherited from your parents. Age. Individuals over 65 years old are more at risk for hypertension. Race. Black non-Hispanic individuals have a higher incidence of hypertension. Living with obesity. Living with obesity can lead to a few cardiac issues, including hypertension. High alcohol consumption. Women who habitually have more than 1 drink per day, and men who have more than 2 drinks per day, may be at an increased risk for hypertension. Living a very sedentary lifestyle, lowered levels of fitness have been connected to hypertension. Living with diabetes and/or metabolic syndrome. Individuals diagnosed with either diabetes or metabolic syndrome are at a higher risk of developing hypertension. High sodium intake. There's a small association between daily high sodium intake, more than 1.5 grams a day, and hypertension. Treatment options for high blood pressure. If your doctor discovers an underlying issue causing your hypertension, treatment will focus on that other condition. For example, if a medication you've started taking is causing increased blood pressure, your doctor will try other medications that don't have this side effect. Lifestyle tips to lower your risk of hypertension. Add fruits and vegetables to your diet. Limit sugar intake. Reduce sodium intake. Set weight loss goals. Monitor your blood pressure regularly. Additional information. If you've recently been diagnosed with high blood pressure, your treatment plan will vary depending on factors. These include the severity of your high blood pressure, and what medication your doctor thinks will work best for you. The good news is that in many cases of hypertension, lifestyle changes can be powerful tools for managing, or even reversing, your diagnosis. These changes include incorporating more nutritious fruits and vegetables into your diet, getting more physical activity, limiting your sodium intake, and limiting your alcohol consumption. The best way to treat your hypertension is to follow your doctor's order. Please like and subscribe.